In the United States, 28.9 million people ages 12 and older have had an alcohol use disorder, according to the 2023 National Survey on Drug Use and Health. Tonight, we are joined by Dr. Nzinga Harrison, co-founder of Eleanor Health, to discuss alcohol addiction and recovery options. So thank you so much for joining us here today. We want to start here. How do you define a substance use disorder, and what differentiates it from casual or social use?
Yes, what differentiates a substance use disorder or alcohol use disorder specifically from social or casual use is continued use despite consequences. So at the point you start to have either physical health consequences, mental health consequences, or social consequences that come directly from how much you're drinking, that's when we start to meet diagnostic criteria for a substance use disorder.
And what are some of the most common signs and symptoms of an alcohol use disorder?
Sure. So it often starts kind of innocently, if you will. So it may be today I'm only going to have one drink after work and I end up drinking an entire bottle of wine. Or I'm not going to drink at all and you end up feeling compelled to drink. Or your significant other says, I feel like you're drinking too much because we're fighting more. Or your performance at work, it starts to get harder to get to work on time. Physical symptoms can be waking up in the morning feeling hungover and needing a drink first thing in the morning, kind of to calm down those symptoms. Or your doctor may tell you you're unable to lose weight to meet your goals because of how much you're drinking, or your sleep is disrupted because of how much you're drinking. And then mental health symptoms very commonly are mood swings, or anxiety and depressive symptoms.
Yeah. What myths or misconceptions about alcohol use disorder do you encounter often?
I think the biggest misconception is that in order to have alcohol use disorder, you have to have lost your family, lost your job, be homeless, kind of living in the street, begging, kind of that concept of quote alcoholic that we have with the brown paper bag. When in reality, we have alcohol use disorder diagnosis that is mild, moderate, severe. And so, of those symptoms I mentioned before, we have 10 diagnostic criteria, and you only have to meet two to meet a diagnosis of alcohol use disorder mild. And so, the earlier, if you or someone who knows you, that cares about you, even ask the question, that's the time actually to start getting support before it turns into that severe form of the condition.
Okay. And what are the most effective evidence-based treatments currently available?
Yeah, so I want people to think about treatment for alcohol and other substance use disorders the same way we think about other medical conditions like diabetes, asthma, high blood pressure. So we have medications, and three of the FDA approved medications for alcohol use disorder are naltrexone, which is a pill you take once a day, Camprol, which is a pill you take 3 times per day, and Vivitrol, which is a shot that you take once per month. All of those have been associated with helping people decrease risky drinking and control alcohol use disorder. You also want to treat any depression or anxiety. From a therapy perspective, we have cognitive behavioral therapy, we have relapse prevention, we have substance use disorder education. And from an environmental perspective, we know that removing triggers, so people, places, and things, can decrease that compulsion to drink. So a combination of all three of those is the evidence base for best outcomes.
Gotcha. And can you explain the differences between inpatient and outpatient treatment options and how someone might know which is specifically right for them?
Yeah, so inpatient is what people typically think of when they think about rehab. And it means you go somewhere and you stay there overnight. So there's inpatient, which is usually like in a hospital setting. There's residential, which is less medical, but still you spend the night there. And those are typically inpatient, maybe 5 days, residential rehab, which is what people think about, usually 30-ish days. What's really important is that alcohol use disorder and other substance use disorders are chronic conditions. So 5 days in the hospital doesn't cure it. 30 days in residential rehab doesn't cure it. Outpatient treatment then happens in your own community. So you can keep going to work, you can keep being at home with your family, you can connect to your care team and get that longitudinal support that helps you control your drinking or other substance use in the way that you want to. And that's what we provide at Eleanor Health is outpatient treatment. And we also provide that virtually so you can connect from wherever you are without having to drive to a doctor's office to get support.
We have about 30 seconds left here. Thank you so much, but I want you to give a chance to tell the audience kind of what ways they can reach out to you all if they need help.
Absolutely. So you can find us at eleanorhealth.com. You can actually there get our phone number to give us a call, or you can schedule directly your first appointment, and you don't have to know if Eleanor is right for you. If you're concerned about your alcohol or substance use disorder, just reach out to us and we'll do an evaluation and help you get to the level of service that's right for you.
All right, thank you so much. Great points there. And remember, if you missed this entire interview, you can find it on our website, WFMYnews2.com. Before we go to break, let's check in with Claire. Claire, we've got that rain coming in and out in our area.